Hi, I'm Jennifer Allen reporting for RSNA News. I'm talking with Dr. Gary Luker, editor of Radiology, Imaging Cancer, and professor of Radiology, Biomedical Engineering, Microbiology, and Immunology, and the associate chair for clinical research in the Department of Radiology at Michigan Medicine in Ann Arbor. We're talking about radiology's transition to the new normal as radiology practices begin to reopen after the first COVID-19 surge. Dr. Luker is the author of a new Radiology Imaging Cancer article entitled Transitioning to a New Normal After COVID-19, Preparing to Get Back on Track for Cancer Imaging. Thank you, Dr. Luker, for joining me today.
Pleasure to do so. Thank you.
Overall, where are radiologists in terms of returning to practice?
I think most institutions, both private and academic places, have largely recaptured most of the imaging volume that they had prior to the shutdowns enforced for COVID-19. That doesn't mean that things are back to normal in any way, sense, or form. There are restrictions on how you can interact with people. There's social distancing, people are wearing masks. But I think there's a concerted effort to at least re-engage the larger community of people who need imaging studies, not only in cancer, but in other areas of clinical care. And I think the research aspect is also progressing more slowly than the clinical side, but we just, at the University of Michigan today, in fact, received notification that we can increase our lab capacity to 45% of normal as opposed to 30%. So we're heading in the right direction, at least at Michigan, but clearly there are regional variations throughout the country and world, depending on how extensive or not the effects of COVID-19 have been.
So what are the first steps radiologists should take when returning to practice?
I think there are several. One is trying to re-engage with patients. For the shutdown of COVID, for example, for screening studies for cancer, lung cancer screening, mammography, for example, the message was, please stay away from institutions. You can defer this study. I think now radiologists need to make a concerted effort to reach out and say, please return. And we are making a safe environment for you to come back and be a part of the imaging studies that you need. So please don't defer your care any longer. I think that as radiologists return to their practice, they also need to figure out ways to interact with their colleagues. Sometimes that's Zoom in formats that are unfamiliar, at least until 3 months ago. Sometimes it's meetings of 4 people in a room that could hold 40. But I think ways that we can start to re-engage with each other, and hopefully at least in a more personal way, and re-engage with the other specialists in healthcare who rely on our interpretations.
So what core issues do radiologists need to focus on overall?
I think that there are tremendous opportunities for radiologists, not only to resume the practice that we've been doing, in terms of clinical care for years, but I think there are opportunities now to branch out beyond that. For example, the podcast for Radiology, Imaging Cancer that just launched today has a series of interviews with experts in the field of disparities in oncologic imaging. And I think that there are opportunities for radiologists to reach out to communities that may not have been previously engaged very well and to make an impact there and to become more of ambassadors in global health and disparities research, because not only cancer, but clearly COVID and many other diseases have disproportionate effects on some minority groups within our country. And I think that radiologists are positioned to help recognize those groups and to reach out to them.
So what are the biggest challenges radiologists will face after the COVID-19 pandemic?
It's hard to restrict that to the time frame you allot me for the question. I mean, it extends across all areas. I mean, in the research aspect, most clinical imaging studies have been stopped or at least shut down in large part, and now trying to ramp that back up again. Recapture patients who may have been on longitudinal treatment studies and convince them to come back in for their studies. For wet lab research, learning how to conduct that in environments that require social distancing, reduced numbers of people, and an altogether changed environment. In terms of clinical practice, again, how do you train residents? How do you train fellows when the normal format has been we sit next to each other and review images? That's not really okay now, or clinical care conferences, things like that. So, I mean, those are challenges in terms of how to train people and how to communicate effectively, and in a way to try to recapture the interpersonal communications, those we meet in the hallway type of things, I ran into you going down to the cafeteria. Those type of interactions are the biggest challenge to recapture, because no matter how many Zoom virtual coffee hours you have, it's not really the same.
That's very true. So are there any changes that have been implemented during the COVID-19 pandemic that will exist post-COVID pandemic?
I definitely think so. I mean, a lot of places, University of Michigan included, have rolled out remote workstations so people can read studies remotely. I think that's going to remain in place because institutions have spent the money for these workstations. It reduces commuting, improves overall quality of life for people, and in many cases provides clinical reads and care faster than otherwise. I think, despite my comments about Zoom earlier, many meetings will remain on Zoom, and that can be much more efficient. For example, at a place like the University of Michigan, if I'm going to have an in-person meeting with someone at one of our, like the North Campus, as opposed to the medical school campus, that's a 30-minute bus trip one way to do the meeting and then 30 minutes to come back. So that's a lot of time out of the day. So, I mean, I think some of these things will continue, and I think that that'll be to the better of people. I mean, if we can cut down on commuting time, if we can cut down on time spent just waiting for things, that's a plus. I mean, obviously some of that waiting time generates the impromptu interactions that I think everyone values, but I believe there'll be a happy medium where not every meeting has to be face-to-face for an hour.
Great. Thank you so much for your time today, Dr. Luker.
It's a pleasure to talk with you, and I appreciate the opportunity to do so.
For updates and the latest scientific research, guidelines, and consensus statements about COVID-19, visit rsna.org/COVID-19. And as always, you can find more radiology news at rsna.org/news.